Alrighty. Hi, Elena. Thanks so much, for meeting with me today. I've got a specific client I want to focus on today because I need some very specific feedback on how to progress. So Jake, he's 35 years old. He's come to me for work-related anxiety that's becoming quite debilitating and seeping into his personal life. So he worries a lot about the quality of his work, his time pressure, the time pressures he's under, his reputation at work. He's also got a lot of worries about his relationship with his girlfriend, taking time away from friends and hobbies because he's taking a lot of work home with him. Work is just enveloping his life. He is beginning to engage in some compulsive behavior, which is a bit concerning. So, checking things multiple times, taking work home with him, as I've said. He has mentioned some trait perfectionism. So, I do believe perfectionism is driving the anxiety and the stress. Long term, the goal for Jake, really for me, is to manage his anxiety and perfectionism to be able to function better. But specifically, I want him to leave work at work. And I want him to have a life outside of work and continue with his leisure and his social activities. So to get there, I was tossing up between ACT and CBT. I did choose ACT for a few reasons. I've just done the short course with the AIPC, so I thought it would be great to practice it on a client. I myself, as a client, have found ACT the most effective long term when compared with CBT, and I did a little bit of narrative therapy as well. So I'm absolutely biased and playing favorites here. But that is what I want for Jake as well, is to develop permanent, healthy coping mechanisms. I don't want him to be a client forever. I need to teach him skills, and he's able to move on. Empirically, because I couldn't make up my mind, I read a few comparison studies. So overall, it seems that while there's theoretical divergences, there is evidence that both CBT and ACT, utilize metacognitive, and behavioral adjustment techniques. These both focus on maladaptive, cognitions and coping mechanisms. So both, attack similar processes. They also tend to achieve similar therapeutic outcomes, according to the research. So, an ACT is definitely effective at treating anxiety and can treat perfectionism as well. I thought specifically with Jake, the goals of psychological flexibility and committed action would be a suitable antidote specifically for perfectionism induced and anxiety, targeting, I think, the binaries of success failure, the catastrophizing, which Jake, has shown some, shown some symptoms of, and then, intolerance of mistakes can all be targeted by ACTs, like so as well as also very malleable. So we can modify Jake's therapeutic goals, or even he can reevaluate his values and his committed actions that he's decided to take as we progress. Problem though, there is a risk with the flexibility here. So for people like perfectionists who prefer instructions, set goals, prescriptions, the vagueness can be a little bit jarring and hard to engage in with ACT sometimes. Attacking perfectionism in general is a challenge, as some clients see it as a positive trait. And even Russ Harris in one of the workbooks for therapists, does mention that clients can be very, very resistant in general to cognitive diffusion and self as context principles. So that is going to be a bit of a challenge, I think. Like any treatment, the effectiveness is going to be partly dependent on how well suited it is to the client, but also the client's agreeableness. I do, however, think Jake, it's going to be very suitable for Jake. He's expressed some self-awareness, of his own, perfectionism, as I said, and obviously has a problem-solving mindset, as he's very overactive. So I think that can be an asset to him. We just need to change tracks a little bit. He's also already alluded to what's important to him, which is work and relationships. So I think he'll be very receptive to unpacking his core values. And then again, he's an active problem solver, not an avoider. So I think he will be, ready to engage in some committed values-based action. Sort of, again, some things that crossed my mind. I'm also still learning. So this would be my first application of ACT with a client. And because it's such a malleable technique, it's going to be very difficult to gauge my own efficacy and effectiveness. So we're going to have to, I guess, check in regularly. I am also, hoping that I'm going to remain neutral and objective, but because I am such a champion of ACT because it works so well for me, there is a bit of a risk of my being a bit resistant to change if it's not working. Say if Jake wants to go in a CBT direction or, something else. But I do have that in the back of my head. I'm going to be vigilant of that. The other side, though, of being a beneficiary of ACT is that I can absolutely empathize with Jake with what he's going through now, but also sometimes the struggle. It was a bit of a struggle for me to implement mindfulness and things like that. So I can self-disclose, and empathize, which is recommended in ACT. Self-disclosure is recommended anyway for Therapeutic Alliance. So I've merged sort of the goals in the treatment plan. So I'll take you through that now. Overall, my goal for session two really is going to be just to introduce the concepts of workability, of creative hopelessness, and acceptance to Jake. So this is to at least begin to alter Jake's perspective on his current thoughts and strategies, and ultimately to sort of cultivate an appetite in Jake for developing psychological flexibility, values-based living, and committed actions. So essentially, I'm just planting the seeds for some future sessions. So from what I've read from all of the treatment manuals, this is generally the focus of sessions two and three. So we may not get there in one session, uh, but I have some faith in Jake. I think I'll be able, he'll be able to have a little bit of a different perspective, after this session. So the first activity I want to do next session will be the clipboard exercise to demonstrate inflexible attention and fusion. So I don't have time to describe it here, but it is in my notes. And my psychologist, did it on me when I engaged in ACT, and it was very clear. It was a really good demonstration. So I think it works well. After the clipboard exercise, I want to describe ACT to Jake, the concepts of psychological flexibility and committed action. So that really he's got some idea of where we're headed and what the goals are, I guess, from my perspective. And of course, I'll work with him, to sort out his own goals. I did actually think showing him, again, it's in my notes, the diagram from ACT Made Simple by Russ Harris would help to sort of clarify the ACT principles. So I think I'm just going to print that off and sort of show that to him. Demonstrates it very well. I then afterwards want to just very briefly describe coping mechanisms to Jake. I want, very basically, I want to emphasize that there is nothing wrong or bad um, about Jake or about the current methods that he's using. He is a very normal human being. We all engage in coping strategies. Some are just healthier than others. So I really want to maintain that emphasis over all of the sessions, but I want to introduce that now that we're just trying something new. Next, what I want to do is somewhat of an exercise. I want to ask Jake to tell me about some common worries that he has and then the actions that he takes generally to remedy those worries. And then I want to, I guess, mirror that, the concept of unworkability with a metaphor. I also, while he's doing that, want to make some notes according to Harris's process assessment. So again, it's in my notes, but it's very basically for the therapist to just record the client's presentations of the 6 core maladaptive processes. So I won't fill that out all in one session, but I just wanted to start recording some things like that. Now the metaphor that I use, I'm a little bit stuck here. If Jake sort of emphasizes that his thoughts are his biggest burden, his biggest worries, such as he's mentioned my boss will regret promoting me. I can use the milk, milk, milk exercise, which I think is very effective at extinguishing the meaning, of the words of language. However, if it's more about excessive engagement or compulsions, which I think it is, such as repetitive email revisions, as he's mentioned, I am a little bit stuck. I did actually explore ACT for OCD, and I struggled to find metaphors that demonstrated compulsions very clearly. So I'm a little bit concerned about how well I'll be able to demonstrate what I think is inflexible attention and cognitive fusion in compulsions. So my best option, I think, would be to twist the polygraph metaphor that is in my notes But very basically, that demonstrates that actively avoiding worry actually increases worry. Uh, I'm just not sure how congruent that is with compulsions, so I need a bit of help with that. What I will definitely do though is give him some homework. So I want him to read chapter, I think it's chapter 9, but chapter Urge Surfing from The Happiness Trap by Russ Harris and Sean Hayes, not Sean Hayes. Um, it has some tips to help assess whether to act or not on urges. And it's, again, just introduces mindfulness very gently. And I think that would be really helpful at targeting his compulsive behavior. Now, lastly, again, if we have time, I want to just gently introduce the concept of mindfulness to Jake with the PowerPoint slides that are in my notes. I think they demonstrate mindfulness really well. Well, they demonstrate tunnel vision really well and why mindfulness is necessary, and it's helpful to notice what's going on around you. And I want to practice the notice 5 things exercise with Jake again, really just to introduce mindfulness again, and merely just to start practicing it. We need to start practicing mindfulness. So I also am going to ask Jake to attempt to to implement the notice 5 things exercise the next time he feels anxious. So say try it 3 or 4 times before session 3, and I'm get him to report back to me how well he did. So I do think I have some good ideas, but I am a little bit stuck on certain things. So I'd be grateful to get some feedback.